Hello and welcome to my channel. In this lecture we'll be continue discussing the male internal sex organs. So let's begin. Now we'll start again from the urethra in the males. It starts from the internal urethral um, sphincter or internal orifice to the external meatus at the tip of the glans penis, and it has a pre-prostatic part, prostatic part, membranous part, and penile or spongiose part that has a bulbar part at the beginning of it. As you can see here, the different parts of the male urethra. Now, the pre-prostatic part is in the wall of the urinary bladder. As we learned before, the muscles at the detrusor muscle at the neck thickens to form the internal urethral sphincter, and this surrounds the pre-prostatic part of the urethra, as you can see here. It's about 1.5 centimeters surrounded by the neck of the urinary bladder. Now, the prostatic urethra starts after the pre-prostatic urethra pierces the base of the urinary bladder, as you can see here, traverses the prostate more anterior to the anterior surface rather than the posterior surface, and the urethra then emerges from the anterior surface above the apex of the urethra and apex of the prostate. And this is a multiple choice question that I had to answer one day. The exit of the urethra is superior to the apex of the prostate, not from the apex of the prostate. Now, this prostatic part is around 3 to 4 centimeters, and it's the most dilatable part. This is another MCQ question about the prostatic urethra. It's the most dilatable part. It's not the widest, I think. The widest part, maybe the fossa navicularis in the glans penis, but this is the most dilatable part. Which is the prostatic urethra. Now, in the prostatic urethra, when you dissect it and look at the posterior wall, you will find this urethral crest. You can see that. This is the urethral crest. In the middle of the urethral crest, there is a prominent colliculus called the seminal colliculus or colliculus seminalis in the middle of the urethral crest. And careful observation of the colliculus, you will find out there's at the summit of the colliculus, called the verumontanum, there is an opening of the utricle inside the prostate. Remember, we studied the utricle, which is part of the prostate and is a remnant of the paramesonephric duct behind the prostatic urethra. It opens here. This is its opening at the summit of the colliculus seminalis, while at the sides of the seminal colliculus you can see these two openings for the ejaculatory ducts. So the ejaculatory ducts also open in the seminal colliculus, but at the sides. At the summit is the prostatic utricle. Now, above, besides each elevation besides it is two depressions, as you can see here. These are the prostatic sinuses, and careful observation of the sinuses, you will find minute openings for the glands of the prostate in the prostatic urethra posterior wall in the prostatic sinuses. So the openings in the sinuses belong to the prostatic glands. The openings in the colliculus seminalis belong to the utricle at the summit, and at the sides belong to the ejaculatory ducts. Don't forget this arrangement. And these features are on the posterior wall of the prostatic urethra, not the anterior wall. Okay, the membranous part of the urethra, which is only this part, see, it's in the deep perineal pouch. It's surrounded here by the sphincter urethrae muscle and the insertions of the deep transverse perineal muscles. Now, these muscles, the deep transverse perineal and the urethral sphincter, are called the urogenital diaphragm. So it traverses the urogenital diaphragm. Lateral to it or besides it are the bulbourethral glands. Now, the glands themselves are besides on the sides of the urethra, but their ducts pierce the membrane, okay, inferior fascia, the membrane and the perineal membrane, and become part of the superficial perineal pouch. This is another multiple choice question. The gland itself in the deep perineal pouch, while the duct is in the superficial perineal pouch, opens into the bulbous urethra. As we will study in the structure of the penis. Okay, so this is the membranous part. It's the least dilatable and narrowest part. So remember, it's surrounded by muscles, the external urethral sphincter and the deep transverse perineal. Now, external in male, okay, but in the female, the membranous urethra is also surrounded by the urethral sphincter, only called urethral sphincter. But here in the male, because we have internal, we have external urethral sphincter and the deep transverse perineal, together called the urogenital diaphragm, that surround the membranous part of the urethra. Okay. Now, the bulbourethral glands function is to secrete what's so-called the emission. It's before a clear liquid secreted before ejaculation to prepare the urethra for the ejaculation. Okay, and don't forget that the body of the glands themselves are enclosed in the urethral sphincter, but their ducts are in the superficial perineal pouch. Okay, the penile part starts with the bulbar part here, the continuation of the urethra after being membranous. Now it's the bulbar part, and then the spongiose part, or in the corpus spongiosum of the penis, till it opens in the external urethral meatus here. Now it dilates before the end as the fossa navicularis. Fossa navicularis is a dilation, wide part of the urethra present in the glans penis, okay, in the termination of the penile urethra. Now in the bulbous urethra we have lacunae by the secretions of the bulbourethral glands, and also the bulbar urethra, because the mucosa it's slightly folded, so it's site for impaction of the catheter. The penile catheter, Foley's catheter, it gets a resistance when passing through the bulbous urethra. That's why you have to straighten the penis upwards with your other hand before introducing the Foley's catheter. Okay? So don't forget the navicular fossa, don't forget the bulbous urethra and its lacunae. Okay? And that it's the site for the opening of the bulbourethral gland. Okay, this is the rest of this is all the male urethra. Now, what about the female urethra? It's exits from the urinary bladder. There is no internal sphincter here. Exits from the internal meatus, runs in the deep perineal pouch, embedded in the anterior wall of the vagina. As you can see here, this is the anterior wall of the vagina, and then pierces the perineal membrane and opens in the superficial perineal pouch in the vestibule. We will study this with the female external genitalia. So it's in the deep perineal pouch. It's 4 centimeters long. That's why it's easy to catheterize a female rather than a male, because you will only catheterize these 4 centimeters of urethra. It has a urethral crest, glands, and lacunae as in the males. But now please The membranous, the urethra, female urethra, which represents the membranous urethra in the male, is not surrounded by the glands, bulbourethral glands. The bulbourethral glands in female descended through the membrane to the superficial perineal pouch, becomes the Bartholin's glands. We will study this with the female external genitalia. So there are no bulbourethral glands lateral to the female urethra, like the case in the male, but it is surrounded by the external by the urethral sphincter, the same, and at the sides receives the insertion of the deep transverse perineal muscles. Now for the ductus deferens or vas deferens of the male, it starts at the tail of the epididymis. You see that? This is the testis. These are the efferent tubules that open into the epididymis. This is the tail of the epididymis. So it's a continuation of the tail of the epididymis, the vas deferens, and ascends as one of the components of the spermatic cord. Remember that? We learned that with the anterior abdominal wall, with the spermatic cord with its blood vessels, and then enters through the inguinal canal from the superficial ring to the deep ring and emerges from the deep ring. Now medial to the deep ring are the inferior epigastric vessels, so it emerges lateral to the inferior epigastric vessels. It becomes anterior to the external iliac artery, crosses medial over obturator and vessels, obturator nerve and vessels, and the obliterated umbilical artery, then crosses the ureter. As you can see here, see that? Goes further backwards and then medially, crossing the ureter. See, this is the ureter. It crosses over the ureter and becomes medial to the ureter and medial to the seminal vesicles at the back. It descends posteriorly between the posterior surface of the bladder and the upper pole of the seminal vesicle, as you can see here, and then becomes medial to the seminal vesicle. There it dilates to form the bulb of the vas deferens, or the ampulla of the vas deferens, and it can be felt as a cord-like structure during digital rectal examination. Okay, it joins the duct of the seminal vesicle to form the ejaculatory duct. So it comes from the deep ring related to the external iliac artery, obturator vessels and nerve, and then curves medially and descends downwards between the seminal vesicle and the back of the urinary bladder, becomes medial to the seminal vesicle, dilates at the ampulla of the vas or the bulb of the vas, and then opens in common with the seminal vesicle in an ejaculatory duct on each side. Okay, it receives its blood supply, the vas deferens, from the superior vesicle and testicular arteries. Remember the testicular artery? Okay, so this is the blood supply of the vas deferens and the course and relations of the vas deferens. Don't forget the fact that it crosses over the ureter at the superolateral angle of the urinary bladder. Now, the seminal vesicle, actually it's not a vesicle, it's a tube coiled upon itself many times. It's a sacculated coiled tube, 3 to 4 millimeter in diameter, and if you uncoil it, you will get 10 to 15 centimeters of tube. The upper pole is a cul-de-sac, as you can see here. It's lateral to the ampulla of the vas. Okay, the lower pole forms the duct that will open with the ampulla of the vas as an ejaculatory duct. Anteriorly, it's related to the back of the urinary bladder, termination of the ureter. Remember, the ureter coming this way to open in the superolateral angle. Posteriorly related to the rectum, separated by the rectovesical fascia. Medially to the ampulla of the vas or the bulb of the vas, and laterally to the prostatic venous plexus present at the sides and the anterior surface of the prostate, draining into the internal iliac vein. So these are the relations of the seminal vesicles. Okay, they extend upwards and laterally, as you can see here. Now the tips or the top of the seminal vesicle is covered by peritoneum reflecting from the rectum. Now be careful here, because if there is an abscess or something in the wall of the seminal vesicle and you are performing digital rectal examination, don't, if you suspect a case of an inflammation or an abscess formation, do not press on the seminal vesicles anteriorly in the rectum, because this will rupture and produce peritonitis, which is a much dangerous case than only inflammation of the seminal vesicles. The seminal vesicles contain numerous goblet cells that secrete most of the semen. Its alkaline secretion contains fructose for the nutrition of the sperms, and coagulative enzymes like the vesiculase. Remember the fibrinolysin, the counter enzyme that is present in the prostatic glands. So the two enzymes oppose each other. The blood supply is by the inferior vesical artery and the middle rectal arteries. Venous drainage to the internal iliac internal iliac veins, and nerve supply from the inferior hypogastric plexus. Of course, ejaculation involves contraction of the seminal vesicles and the bulb of the vas and the prostate to eject, and with the muscles of the perineal muscles to expel the semen outside through the penile urethra. Don't forget this, okay? Also, another question: is it a reservoir for sperms? No. The seminal vesicle is not a reservoir for sperms, okay? Okay, but it's responsible for most of secretion of the semen. The ejaculatory ducts now, see, this is an ejaculatory duct. It traverses the prostate. Remember, it's that ejaculatory ducts traverse the central zone of the prostate, okay? Descend anteriorly and open in the urethra, which is in the transition zone of the prostate. The ducts themselves are in the central zone, but open in the urethra in the transition zone, because the transition zone surrounds the urethra. Open in the back of the prostatic urethra, posterior wall, in the seminal colliculus, remember, at the sides of the seminal colliculus, after skirting around the prostatic utricle in the middle and posterior too. So they both run in the central zone of the prostate, and then open in the prostatic urethra. It's in the transitional zone of the prostate, and after skirting around the utricle, and open in the colliculus seminalis. Okay, these are the ejaculatory ducts. Remember them. In the old classification or lobation of prostate, they lie between they are the posterior boundary of the middle lobe and the anterior boundary of the posterior lobe. The ejaculatory ducts. The blood supply by the internal pudendal, inferior vesical artery, and middle rectal arteries. The venous drainage to the prostatic venous plexus. So this is the blood supply and venous drainage of the ejaculatory ducts. Okay, now the nerve supply to these structures from the prostatic plexus of nerves. This is derived from the inferior hypogastric plexus. Now the inferior hypogastric plexus is a plexus of nerves on the lateral pelvic wall on the sides of the pelvis, and it receives a parasympathetic component from sacral 2, 3, and 4, distributed with the vessels to the pelvic viscera. Okay, the sympathetic contracts the seminal vesicles. The sympathetic is responsible for ejaculation. So remember, erection is parasympathetic, That's why you ask a diabetic patient if morning erection is lost or not, or weakened, because erection is parasympathetic, and during sleep parasympathetic dominates. So you are asking about the condition of the minute nerve filaments that will produce this effect during sleep. But the sympathetic is responsible for ejaculation, so it contracts the seminal vesicles, ejaculatory ducts, and the internal urethral sphincter. Why the internal urethral sphincter? To prevent regurg of semen to the urinary bladder, and at the same time, the sympathetic inhibits the detrusor muscle. Of course, because we are not in a process of evacuating the bladder here, we're in a process of ejaculation. Okay, the parasympathetic produces is erectile effect by vasodilation of vessels. Well, this concludes the male internal sex organs. I hope you got the maximum benefit from this lecture, and thank you very much for watching.